Dr. Gary Linkov here with City Facial Plastics, and today I wanted to talk to you about surgical lip lift. So sometimes the corners of the mouth can droop, and there are different ways to treat that. One option is to use Botox into the DAO muscles. Those are these muscles down here that are pulling down the corners of the mouth. Another option is with filler to build up the oral commissures and bring those corners up. A third option is something called a corner lip lift, which isn't the right surgery for the majority of patients, but there is a small percentage for whom this might help. And that involves a small incision along the lateral aspect, the sides over here of the vermilion border, that's right along this upper lip border, and removing a small amount of tissue and lifting those corners up. Those are all options for corner of the mouth, the drooping. The upper lip lift, what it does, it actually does shorten this philtral distance. And what that is between the base of the nose and the upper lip, there's something called a philtrum, and doing this procedure will shorten that distance. One of the great things about an upper lip lift is that it does bring out more of your upper teeth. That is something that other modalities like lip filler cannot do. Lip filler tends to bring your upper lip down and out. What the lip lift does is that it brings the lip up and back, also exposing more of your upper teeth. So there are different ways to do the upper lip lift. My favorite way to do it, and I actually call this the Ella lift, but what it is, it's basically a modified type of upper lip lift that is primarily of a bullhorn shape underneath the nose. That is my preferred modality. There are other ways to do an upper lip lift. One option is to make incisions along the vermilion border, which used to be done many years ago. Nowadays, it has fallen by the wayside because of potential for poor wound healing and scarring in a very visible place. So to determine if you're a good candidate for an upper lip lift, you start with knowing the distance from the base of the nose to the center of the Cupid's bow, right at the junction of the white portion of the lip or the dry lip and this red part of the lip. Once you have that distance, you also need to take into consideration how much of the upper teeth are showing. And those are two of the most important factors in determining if you're a candidate. Another factor is the ratio or the proportion of the base of your nose to the width of your mouth. If your nose is really narrow and your mouth is very wide, then what could happen with an upper lip lift in the way that I do it is that you can pull the central portion of the lip and make it look a little artificial. So the ratio of the base of the nose to the mouth should be close to about 0.8 to 1 in order to get the best possible result. It takes about 1 week for the swelling to significantly go down. It will then continue to resolve over the course of 2 to 3 weeks. The bruising, if you develop bruising, can be there for up to 2 weeks. The redness of the incision line is there for, on average, about 6 weeks, can take a little bit longer than that, and the incision line heals over the course of 1 year, gradually improving. I use scar gel on all my incisions for up to 3 months, which helps with wound healing, and ointment in the initial recovery period before we start the scar gel. A lip lift in the most modern way is not something that's done just for a drooping mouth. If someone has major drooping of their mouth, there are other things that can be done, such as a corner lip, such as Botox into the DO muscle, or filler into the oral commissure areas in order to raise the corners of the mouth. A lip lift traditionally does not address that concern. A lip lift can look extremely natural, and this is because you're extending the incision along the entire base of the nose, making sure that you get a lateral extension. That's very important, so that not just the central portion of the mouth is being lifted, but you get that extended lift that makes it look very natural and doesn't give you that sort of overdone look. A lip lift and a rhinoplasty can go hand in hand. The actual incisions for each are spaced apart, and so it has been shown through different research studies that that is actually a safe way to perform both at the same time. There are a couple of things that can be done to optimize the appearance of the scar after an upper lip lift. One is using something called Kenalog, which is a type of steroid, to inject it into areas that look like they're starting to get hypertrophied, or where instead of a flat type of scarring, you're starting to see a bit of a raised look. So you can inject steroid, usually no earlier than approximately 2 months after surgery. And you can do that serially every few months if you're seeing benefit. Another option for scarring is to use laser to actually resurface the incision. And again, that creates a much more subtle appearance to your scar. And the last option is to go back in and surgically revise that scar. Now, there's a limit to what can be achieved with a surgical revision, but it can be made to look much better. But the way that your lip lift incision is designed initially, the first time, is extremely important for figuring out what can be done later to try to optimize that scar. I hope you enjoyed this Q&A about upper lip lift. I am Dr. Gary Linkov of City Facial Plastics.